Hey guys, it's Amanda with Active Edge Sports Massage, and we are here with Allie, who's a local triathlete and marathoner and kind of an overall athlete. But she has graciously agreed to be a model for us because we're going to be demonstrating some cupping here in the next few minutes. So hang tight. If you guys have questions about cupping, save them until the end because I'm going to be working, so I won't be able to see them, but just you can post on there. And if you have questions, I will come back at the end and write responses later. So we hope you enjoy the next few minutes. This is really just supposed to be a fun time to be educational and talk about cupping and just help you all to learn more because we added it recently. So Allie, kind of give us a little bit just like of your background as far as an athlete, what sports you specialize in, or like what have you done and those sorts of things.
Yeah. So I've run a couple marathons. And I've done a handful of half marathons, and then I just did my first sprint try. Yeah.
Did you like it?
I did. I liked
awesome.
it a lot. But I was a competitive swimmer growing up, and yeah.
That's great. That's awesome. So cupping is not a new thing. Have you ever had cupping before?
No.
Okay, but you've had sports massage before?
Yes.
Awesome. Okay, so cupping is not a new thing. It's actually really old. It's more of an Eastern modality, but we're starting to see more and more of a trend here, and I had clients asking for it, which is why I brought it in. I think the most recent one is everybody talked about like Michael Phelps at the last Olympics. Did you see that?
Yeah, with his little like stuff on his back.
Yeah, absolutely. So the sports medicine team for the Olympics started to add it. So a couple things about cupping. There are two types. There's called wet and dry cupping. So we do dry cupping here at Active Edge. And the other thing with that is that we do not use fire. I know a lot of people ask if we use the fire cups, and the answer is no. That is more if you go to like a lot of Asian places that specialize more in Asian modalities. That's what they use. So we use plastic cups, so they actually aren't even glass, so you can kind of see that and feel it if you want. So they're very safe, very endurable. And then we use a pump right here, you can see this, to attach to the top of a cup. And then what this does is it creates a vacuum. And you'll see us use it here on Allie's quad or thigh above the knee. And so what that does is it creates a vacuum to help get into the deeper tissues. So the benefits for cupping are that they can do everything from relieving pain, reducing inflammation, breaking up fascia. That's a huge one for myofascial work, so like helps unbind and unwind fascia. So just a lot of different things for why people would want them. So I'm going to do a couple of cups here on Allie's quad, and the reason, Allie, why I chose this space is because you have your IT band here, which as a runner you've probably heard people talk about their IT band. And then you have the kneecap, and there's an area where cupping can really come into benefit on what we call the lateral or the outside of the quad. This is a really common spot for fascia to get really gummed up and really painful. And there's a really common trigger point, I would say about a quarter to a third of the way up the quad in this muscle belly here that just really can get really cantankerous for runners, cyclists, and triathletes, which there you go, you got the trifecta. So we're just going to put just a little bit of cream on, and we want to just start with clean skin. And then we put the cup on, and then we do a couple of pumps to go ahead and create a suction. So you can see how the cup is staying on its own, and Allie, you can see how it's kind of created a raised thing. Yeah. Now, this can be a tender spot. Yeah. So when I put it on, what would you describe like what you're feeling?
Well, it does feel a little tender.
Okay.
But it's like pulling your skin up, and I don't know if you can see it on the camera, but it's like pulling my skin up into the...
Yeah, up into the cup.
Yeah. So it feels, it's like a little tingly.
Yep. Do you feel like there's suction there? Like,
yes.
Okay, so you can actually feel it.
Yes.
So we'll do another one just a little bit further up, and if this one gets too tender, let me know, because this one can be a little bit more uncomfortable because that trigger point that sits right in there in that muscle. Now, for the cups, once we create the vacuum, we leave them on there for anywhere from 3 to 5 minutes. So they're not left on there a super long amount of time. But once we get this second one on, I'm also going to show you a couple of other things that we can do with them.
so fascinating.
Isn't it though?
Yeah.
It's really cool. So, I know it might be a little bit hard to see on live, but Allie, can you see how this one is really red and this one is not as red? So I put the same amount of essentially pumps, or created the same amount of vacuum in there, but this one, what that indicates is that this tissue is less healthy down here than this one up here, which actually, for the experience I've had as a clinician, I would actually expect that. So we need to get more, basically improve the health of this tissue down here versus up here. So one thing that I want to do, and Allie, how's that feeling? Is it would you say it's painful?
No.
Okay.
It just is. I mean, it feels tingly and it is a little sensitive.
Yep.
It doesn't hurt.
Yeah. And that's kind of the common thing. I have people ask me all the time, like, does it hurt? And the answer is, it should never hurt. There might be discomfort there. It might be just really kind of a weird sensation, but it should never be hurtful.
Yeah.
So to place the cups is one of the things that practitioners and clinicians do, and we do this as massage therapists in quite a few spaces on the body. So we will create the vacuum and create the cup in one part, maybe work on another area, and then come back to it. The other thing that we do with these is we actually can move them, and that's where a lot of massage therapists do that, because it's really beneficial for lengthening the muscle, again, reducing those fascial adhesions, helping with inflammation, helping bringing blood flow back up to the surface, which is a really good thing. So since we've left this one on for a few minutes, what I'm going to do is just gently move it. And it is a little tricky. Can you feel that?
Yeah.
Now, as I move it, is it any pain or discomfort?
I mean, a little discomfort,
Okay.
but not pain.
Okay.
It's weird when you're pulling your skin
Yep.
and then moving it around.
Yep. So you can see how it does create a little bit of a ring. That ring is okay. It will subside, may have just a little bit of bruising since you've never experienced this before. So I'm going to bring it over and kind of bring it more medially, just to work a little bit more on the medial side of the quad. And Allie, can you see as I move it how the vacuum still continues?
Yeah.
So basically I'm moving that vacuum through the tissue just to help go along the muscle belly and along the muscle bed to raise it up and to create better, more healthy tissue through there. So you can see how we do that. And then because this is just more of a demonstration for how this works, typically I would do quite a bit more through the quad, but for the sake of time this morning, yeah, we're not to the afternoon just yet, barely, but we're still in the morning. I'm just going to go ahead and break the section. So how we take it off is we simply just break the section. Do you feel that?
Yeah.
Was it painful?
No,
Nope.
not at
It
all.
just kind of felt weird, didn't it? That's what I think. It just kind of feels wonky. And then I want to take this one, but you can kind of see on this first one that I just took off, there's a shadow through there. So you can kind of follow where I've been working the cup. Then this one I'm going to work a little bit further up and bring it up. It does take a little bit of force, but again, nothing too bad. So I'm basically falling right off the IT band. This is, again, a common area for a lot of athletes, a lot of runners, cyclists, basketball players, things like that.
What is it like for men who have hairier legs?
Yeah, that's a good question. So what happens if it's hairy legs?
Or females, I guess.
Yep, yeah, totally. No, totally legitimate question. As long as there's enough cream on the skin, so as long as we lubricate the skin and just put enough of a barrier there, it's totally fine. It might have a few moments of discomfort, but it's nothing drastic. Done this on guys as well as gals, and yeah, no problems either way. So with cupping, you might have just a little bit of bruising, like I mentioned earlier. It's okay. It's nothing too serious. But you will have those red marks like Gwyneth Paltrow, Michael Phelps, all the celebrities.
And me.
Yep, and now Allie. She's getting famous. I will tell you one thing that I personally had cupping done, it's been a couple months ago now. Many of you guys know I had a sports injury last year that I had, it's been like 2 years ago that I had that surgery. But I still kind of have problems on my one knee every now and again. Cupping helped a ton just to get things loosened up. I did it. My therapist did it right along the leg here, along the quad, and it just helped with so much. So you can see, Allie, I'm gonna go and break this section. You can see how red that tissue is. It's actually a good sign, getting things woken up. I've done this with clients, and we've done it on either side, like we'll do different shoulders, and I would be interested, and we won't do it here on the live, but to see like if we did this on your other quad, what things would look like, because there's often, I always tell my clients we all have tendencies, so we'll favor one side more than the other. That's very, very normal. And so you see that a lot of times in cupping, like one side of the spine will be like perfectly pink and beautifully healthy and just rosy, which is a sign of muscle health, and then the other side will be like pale and white, and it's just kind of gnarly. I do that with like I did it with a racquetball player. One shoulder, his racquetball shoulder, was having a lot of stuff going on. The other shoulder is perfectly healthy. So it's just interesting to see that dichotomy. So that's a little bit about cupping. Do you have any questions as far as what we did?
No, it's fascinating.
Yeah, it's fun. So we now do offer that here in the clinic at both the West and the downtown. If you do want to schedule it, just let me or Jake downtown know, and we will make sure that gets taken care of. So, and thanks, Allie, for your time coming this morning. So
go get it done. It's fun.
Yeah, thanks. All right, guys, have a good one. We'll see you later. Bye.